Alpha 1 and beta receptor blocker, or alpha 1 and beta adrenergic blockers. How do these medications work? So in general, alpha 1 and beta receptor blockers act in the periphery, in the heart, and the blood vessels. They're considered non-selective receptor blockers because of the effect on the alpha 1, beta 1, and beta 2 receptors, and in general causing smooth muscle relaxation. So when we talk about the alpha 1, beta 1, and beta 2, what you have to remember is that whenever we talk about alpha 1, what is it affecting? We're talking about the arterial. So in general, when it comes to blood pressure and cardiovascular system, alpha 1 pertains to arterioles. And beta 1 is the heart. So we have one heart. Beta 2 is for the lungs. We have two lungs. And alpha 1 starts with an A, therefore arterioles. So it's non-selective, so it affects all those areas. It's not just focusing, let's say, on just the heart. So when we have the alpha and beta receptor blockers, it's non-selective. You have to remember that. Anyhow, so by doing that, it causes a decrease in myocardial contractility, therefore decreasing the oxygen demand of myocardial cells. This is considered a negative inotrope, right? Because we're talking about the contractility. So when you do that, the heart doesn't have to work as hard. Therapeutic effects of alpha 1 and beta receptor blockers include decrease in progression of heart failure, decrease in blood pressure by decreasing constriction, therefore decreasing resistance and afterload. It decreases the heart rate by decreasing the SA node firing, therefore it is considered a negative chronotrope, as well as it decreases the myocardial contractility and decreases the oxygen demand of the myocardium, therefore considered as a negative inotrope. What are the indications for alpha 1 and beta receptor blockers? Indications include heart failure. So this is usually given in conjunction with digoxin, diuretics, and ACE inhibitors. It also treats hypertension and angina. Some precautions include concurrent use of multiple drugs affecting the blood pressure because of the increase in hypotensive effects, pulmonary disease or illness, heart failure, some cardiac dysrhythmias, especially when it comes to bradycardia, and because of the alpha 1 and beta 1 receptor blocker properties, and then it can mask evidence of hypoglycemia from the low serum glucose because of the beta blocker effects. So these medications are contraindicated for patients with pulmonary disease such as asthma because of its non-selective properties. So if it's non-selective, it can cause bronchoconstriction, and in addition, this can be also contraindicated for patients with some other cardiac dysrhythmias. Side effects or adverse effects include heart failure, some cardiac dysrhythmias, bronchospasm or bronchoconstriction, which causes dyspnea and wheezing, fatigue, depression, and impotence. Nursing actions include assessment of heart rate and blood pressure, and also when it comes to physical assessment, it is important to assess for evidence of worsening heart failure. Patient education, we have to educate the patient pertaining to the drug, the side effects, the home heart rate and blood pressure monitoring, other drugs which may interact or affect their medication, hypotension symptoms, renal function, general side effects and symptoms, as well as serum blood glucose. Examples of drugs in this class include Coreg or carvedilol, and normodine and labetalol. Now, what you have to remember is carvedilol. So carvedilol acts as an alpha 1 non-selective beta receptor blocker, and it can also be considered a calcium channel blocker. So that's a very interesting fact about this medication. Anyway, something to take note of to help you remember the differences between the alpha and beta blockers versus just the beta blockers is this. So you have to take note of the suffixes. The beta blockers end in olol, so O-L-O-L, while the alpha and beta blockers end in either ilol or alol, so I-L-O-L or A-L-O-L. So that's one way to differentiate between those medications.